Welcome to a special episode of CarePoints. I'm your host, Kenny Schiff, Chief Marketing Officer for Lone Star Communications, the Alero Solutions Group, and our latest family member, Promobix. Back in April, we took CarePoints on the road to historic San Antonio for an event that Lone Star Communications hosted that brought together our friends at Ronco Communications, Beacon Communications, and Southwestern Communications at the lovely Valencia Riverwalk Hotel. This year's event was all about customer experience, and we wanted to bring in voices of actual customers so that we could better understand together how to successfully partner with complex enterprises like hospitals. Since I'm very interested in understanding how customers think, especially in key roles like IT, I asked Bill Mundt, the Deputy CIO of San Antonio's UHS Health, to give us his perspective on working with vendors, and to probe with him what the characteristics are for great vendor relationships, but also not so great relationships. Bill's an experienced pro, and I think you'll appreciate his candor. Please enjoy our conversation.
But we're a growing organization. We're building 2 new hospitals right now. We're building out a bunch of MOBs, that's medical office buildings. Some of them are connected to the new hospitals. There's a couple that are not. Last year, 2024, we rolled out 15 clinics. So that's how much we are growing. So on top of that, I got my normal job that I have to do. So before I get too much into that, just a little bit about myself is that, and you probably have saw maybe my bio or whatever. Things that you may not know is that, I'm a Oklahoma boy, grew up, and so grew up on a small farm, if you will. And so that's what I have today. So I live in Bernie, which is on the outskirts of San Antonio. And we got about 100 chickens. My wife loves birds. And so, so we got a bunch of chickens, and we used to have ducks and geese. Now we have peacocks and chickens. And so that's a little bit about myself. So I'm pretty busy. I spent a couple weekends this month, and I finished a pond. So I'm hands-on. I love to get outdoors and do things. So not only am I busy at work, and I'm married to the phone as well, right, with outages and everything else going on. I pride myself on being very responsive, I think, and that's something that, myself and Chris, we have a really great relationship, when it comes to the company. So, but very responsive, and so I'm that way, and I pride myself on that, and that's kind of how I grew up, right, in the military, being that way, and so I carry that forward on the civilian sector since 2007. Prior to going to University Health, I was at Chris's Health. I was there for a stint, and really got my feet wet with healthcare. IT, at the end of the day, IT is IT. But really you have to understand the need on the clinician side of the house. And so learned a lot there and really grew from there when I came to University Health. So, but when I first got to UH, right, County Hospital, we had about 30 clinics maybe at the time, whatever. So we have really grown substantially. We're in this, from IT perspective, we have about 75 buildings overall that I'm responsible for to ensure that the network stays up. So how do I keep that going, right? And how am I agile to my boss says, oh my gosh, we got this clinic, we want to open it up in 30 days. So all right, I got to get a circuit in there and make that happen. So there's a lot that we have to do, and I got to make it happen to ensure. And within the last 12 months, I would say there's been a lot of change at University Health. Besides, okay, we're going to build some hospitals and some MOBs and other clinics as well. But my boss, Bill Phillips, he was the CIO. Now he's the COO, right? And so now I got this extra responsibility that I have to take on. And so, it's been a lot of growth myself as well as responsibility. So, it really has continued on, especially with, our expansion in these clinics and new hospitals and so forth. So definitely just a lot going on. I'm very busy.
And you can't do it alone. So on one hand, I showed the slide about your budget and your staff and all that,
Yeah.
but you inherently have to rely on vendors, partners, and you have good partners and maybe not so good partners. So let's talk a little bit
Dive into that.
About that. So give me a sense of your vendor landscape. How big are some of those relationships? Give us a sense of, as you partner with people to do things to get what you need to get done over a complex, pretty dense environment. Who are some of those people, and how's that working for you?
Yeah, so being in healthcare, we have a lot of vendors. Biomed at this organization is part of IT, which you see at some organizations it is separate. So we have probably in excess of 400 vendors, and they're all different sizes, from small to major type vendors. We have probably 15,000 endpoints in our environment. So that's quite large that we have to manage, right? Anywhere from a PC to a telephone to a medical device, and so there's a lot that takes place, and you can't do that alone. You can't do that with the staff. I mean, look at 389 staff. I mean, that's really not a lot to handle such vast, and what you're not seeing is a map. So while we are a county hospital and majority of our environment is within Bexar County, right, San Antonio region, but we also have some places that we have to support that outside. They're still in the state of Texas, but they're quite far out. So we're in Corpus, which is 3 hours away. We're in Austin, we're in Dallas. We are spread out, and we have to support that as well. You can't do that alone. You can't do that without help. That's for sure. Not just that, is that we kind of dive into just a little bit. Let me talk about Women's and Children's Hospital that we opened up a year ago, this past November. And so there was a lot that has to take place, no different than the two hospitals that we're building right now. And so you look at new technologies and things are coming down the pipe, as well as technologies that is end of life. And so we were challenged with Cisco having their phones, right? Their Cisco phones being end of life. And that's how it started their relationship really with Lone Star. And so we had to start looking at different type of phones, maybe using a smartphone, right? And then how we're going to get to this point and grow this technology in a new hospital. We can't do it alone. And that's why I called up my friend. And so, and we started having these conversations, and it's really grown from there. And so, with anything with new technologies that you roll out, and you're doing that with the clinical staff, a lot of them are not tech savvy. And so how are you going to get over that, right? How are you going to get around that? It's like taking the technology to your house and maybe talking to your spouse or your kids about that, and how they're going to be able to use this technology successfully. At the same time, they're going to also have to get over this new hospital that they're going to have to learn. And we grew from let's say 20 beds on a floor and maybe the NICU to 3 floors, right? So that is huge. So you got to make it easy on them. You can't do that without having a solid partner, right? And so, and I know we can get into some of the challenges of partnerships and what makes a good or a bad partner overall. But reality is that, you know, you can't make that happen. And I keep my job, right, unless you have someone that's going to be a solid partner, so you can roll this new technology out and help you educate the staff, the clinical staff, on how to use this new technology, right? And that's some of the challenges that we have today.
So what characterizes a good vendor? So, and that could be Lone Star, it could be anybody else. So there have to be some characteristics that you think about, that when you think about your challenges, you understand that you're going to go to this type of organization to work with you because you know they do these things. What are those things?
You know, it is a relationship. It's no different than a relationship with your relatives, or a relationship, you know, co-worker or whatever. You got to have that solid relationship, and it's more than just, you know, what do you want to buy from me today, right? You know, there's a reason why we go to the dealership when we're looking at cars on a Sunday, right? No one wants to deal with that. I don't want to deal with that. You know, you want to physically look at the car because you saw it online for the last 3 months, you've been researching it, and you want to see all the aspects without someone on you, right? You don't need that. And so, look, it's no different when you're on this side, you know, and you're talking to someone. You want a partner, you want a relationship with that person. That's just not about what they're going to sell to you. You know, I have this problem and I need help solving it, you know, and so we can all be successful, both sides, right? And so, and like I already talked about with Chris, is that, you know, we had that relationship. And it started as, hey, I have this problem. I want to get this new technology at UH, and what do you have that's out there? Help me. And at the time, the conversation was really just a simple nurse call. Nurse call is on these stupid Cisco phones that we want to toss in the trash. We want to get these, you know, now these Wi-Fi smartphones, Android phones, and how are we going to make all this work? And it went from a simple conversation of, well, hey, we can do that. And let me tell you what we have, but we can also do these other things. I had no idea, right? That's awesome. And so it really brought us to that next level. And it continues today. And that's a continuation of that partnership that you have. And while I can kind of flow into a partner that's not so good, is the ones that you just dread to meet, right? It is the dealership, right? It is that comparison that, I don't want to go there and buy this car. Maybe we can buy it online, so I don't have to talk to anyone. And maybe we can get the best deal. So the avoidance, right? And that is it. And we've had partners. We've had long-term partners where they had turnover, and then they get a new guy, a new gal in. And okay, you start having those conversations, and then you're trying to fill in the individual out, and can this really be a long-term partner, or maybe not so much? And it starts off okay, and then it ends up being all about sell. And then, you know, yeah, sure, they kind of break the ice. Well, how's the chickens, and you know, all that fun stuff, right? And from that to like, you know, so, you know, let's buy this product from us. And yeah, if I want to buy the product from you, then we would have that conversation, you know. So much that and this individual that I'm thinking about and kind of talking about no longer works at this company. He's since left and moved on to another partner, unfortunately. So, but it's like, it is that avoidance. It is, hey, let's go to lunch. I don't want to go to lunch with you. It's not worth the meal because it ain't free. My wife is like, oh, you get a free lunch today. No, it's not free. You pay for that lunch, right? And that's tough. And so I don't want to say a lie, but you start making up excuses of why you can't go to lunch with this individual, no matter how free it is and how great the place may be that they want to take you to. I'd rather just not and just move on, while that, and I go to Chris because we have this kind of relationship where it's like, hey dude, I got this problem that's going on and, can you help me? Or he says, hey, the app that you guys are using, it can do a lot more than just that. And we should think about, having a conversation. Oh, I didn't know we can do that. And so they bring that new technology to you and they open up possibilities that you guys could be doing at university, right? And so that's what I want. Yeah, bring me the new technologies. And maybe we don't have a need for it. And he understands that. Some partners do understand that. Oh, okay, all right, it's not the right time today, or maybe it's not the right time ever for this. I understand, and they let it go instead of just pushing and all about the sell, right? That kind of thing. So, that's some of the struggles. Being in position that I am is that even. I'm doing avoidance because of these bad partners. I'm not the only one doing avoidance. My subordinates, same thing. They're doing avoidance as well. You start having the conversation, hey, how's your relationship with so-and-so? Oh my gosh. I'd rather just not go to lunch with that individual or meet with that individual because it's all about the sell. It's never about bringing new technologies and just having that simple, plain conversation, and having that relationship, and kind of getting into a little more on a good partnership side is, a relationship is consistent. It is constant. It is not just showing up when you're ready for a sell. It is dropping by. It is saying hi. It is checking in, right? Like you do your relatives, your cousins, aunts, uncles, what have you, brothers, whatever. And so it is that constant. Well, how are you doing? What's going on? And I've had that where you have that good relationship with someone and you're just talking and you say, last week I had this problem. And really it comes down to that I need help. And I need help with this problem. And do you guys play in that space? Is something maybe you can help me with? And that wouldn't have ever taken place. That wouldn't have happened if it wasn't for them checking in and just dropping by and just seeing how you're doing. I haven't seen you in a while. It's been a minute. What's going on with your life? And it doesn't have to be because they're local. It can be just a simple phone call or a text. Chris and I, we text probably more than we talk. Right? Because you get stuff done, that kind of thing. And then if there's a time that you need to talk, okay, that's fine too, whatever. But the point of the matter is that, you keeping that relationship solid and whole, and not just dropping by for a sales. And so we don't have that avoidance, like the car salesman on the, and so forth. So I know I kind of jumped around. No, it's. I continue that on. I see. I'm eating my time too.
We're good on time. So a couple of things I picked up. One is, for you, trust and authenticity are key aspects of the relationship, But the other thing, in terms of some of the prep work we did, I get the sense that you feel that people are inauthentic. And they don't do their homework, and the organization doesn't consistently pay enough attention to who you're about. So when they show up to sell you something, they'll sell you anything, and you don't need them or want them to sell you anything. You want them to know who you are and give you what you need.
Right. Thank you for bringing that up. That is so true. So, or they don't listen to you either, right? We as our ticketing system, I'll give you an example. We use ServiceNow, and we haven't been live on it for that long. We went live last October, and so early 2024, we're in the build process, and I met this young man, and there was a small conference that I went to representing IT, and we're meeting these small vendors here in San Antonio, and he was talking about ServiceNow and so forth, and I said, well, you know, we're rolling out ServiceNow, but what I need at the time, I would like some education and training for our IT staff so they can really understand the ITIL framework and you know, because we're hit and miss. We did the training about 10 years ago, and that's great. It'd be great to have a refresher kind of a training, and great to have another training a little more in depth of those that have zero exposure to ITIL or ITSM, whatever. And so it was great. It was a great conversation. He didn't listen to a thing I said, and then so we set up a conference call, right? So we could continue this conversation, and he brought on some of the other staff that work around. And it was all about, well, if we're not going to help you implement this, then really we can't do any education and training, right? What? How did we get to this point? And now you kind of suckered me in. You wasn't true. You wasn't genuine. And you suckered me in for this call. And so, as you said early on, I am very transparent and I don't hold back. And so I embarrassed him on the call. And I wasn't ugly and I didn't cuss. He didn't ask kind of things or whatever. But I said, that's not what we talked about. And so he was embarrassed on the call because it was all about education training my staff. And that was my need at the time. And they didn't want to take it on. And so we don't need to continue this conversation. And then we can just end this call. And so I abruptly ended it. He reached out a couple months later saying that he wants to do training. No, we're done. We're done. That's it. So, you know, in my mind, I don't even want to deal with you. You're not a solid either. He represented his company, and so I took that back. And now your company, in my mind, is not solid because this kind of staff you guys are hiring, you know, and you're going to try to sell me like that and not be truthful and not listen to what I have to say. And it kind of goes back to, you know, also we've had where vendors, they come to you and they don't know your environment. They don't know, you know, they didn't go online. At least go online and look at our public site and see how many locations that we got. And then whatever technology you represent, you kind of would get a feel for how you're laid out. You know, whether you're a network company or a server company or what have you. You know, don't come to me that you don't know at least somewhat in our environment, so we can have this conversation and try to sell me something that, well, we don't even have a need for. You know, so, you know, that I would say that would be that the both sides of the coin. But again, I guess probably because of my military, I am very transparent and kind of blunt, very brass. But I'm not going to be ugly. But I'm a nice guy overall. I am a nice guy. You know. But
there are certain things that really kind of will tick you off. So, and number one is the vendor partner not doing their homework, right? So, and an inconsistency in the providers from a partnering standpoint. You're going to have to deal with many people. In our organization, there are clinical people, there are IT people, there are sales people, there are marketing people. But we all have to have a sense of who you are as a customer, otherwise we can't serve you. When we were doing the prep you put together a handful of slides about CRM systems. So let's kind of go there for a second. So you get a lot of correspondence from people who are sort of sending you like Dear Bill letters via email.
Oh yeah. Yeah. And let me say that really quick. So so I love it when you get the cold emails, right? Is what they are. It's like cold calling, and it has hi, state your name, bracket. Like, man, I guess their system wasn't working that day when they flashed out that email, right? They couldn't even get my name in there, even though it went to my email address. They couldn't get Bill or William or anything like that, right? I was like, oh, come on, guys. So yeah, you're totally right.
So they're not doing their homework. It's a generic kind of thing. And the thing about hospitals, and I've been working on multiple sides of the business for a lot of years, and hospitals are different just from the standpoint of doing business. And you just can't be treated like a typical consumer. And your needs are, well, you might need to buy Band-Aids, or not you per se, but maybe you need to buy Keystone jacks. But a lot of what you need is really not a commodity kind of thing. And the folks that are in this room are all in the solutions business. And if any one of us sent you an email like this, that's going to go completely to your junk pile, right?
Same thing on LinkedIn, right? You get these on LinkedIn, well, I do all the time. And, it's very disingenuous. Or you get the true spams on LinkedIn that maybe they're coming from China or something like that. And they're like, I'd like to talk to you. Can you send me your WhatsApp or whatever so we can have a communication? Oh man, block, that kind of thing. And so, but yeah, you do get that quite a bit.
So I'm gonna shift to talk about vendor selection in general. So we're happy to be a close partner with you so that every piece of work we do is not putting us through a traditional vendor selection process. Well, some things we do might. But in general, UHS as an organization has standards and procedures in terms of dealing with vendors. Tell us a little bit about your vendor selection process. And a lot of the people in this room are starting to sort of expand the scope of what they do, so they might need to approach people like yourself about things that they are not necessarily known for. So somebody like you is going to be involved in the qualification of all that. Give us your perspective on that.
Yeah, so I mean, we are, at the end of the day, we are a government entity, so we're county ran, and and there's some things that we are required to follow when it comes to purchasing. We prefer DIR or GPO kind of purchasing and stuff. So there's that aspect, but there's also, the loophole of technology. So while the standard stuff, we play the game and we get like 3 quotes and all that fun stuff. Cause, we're gonna buy some more network gear, we're gonna buy some more servers, and that's just, that's a constant, just a rotation. But I like to look at new technologies that's coming down. Of course, AI is big, and I wrote our AI policy and AI governance, and so I love technology because that's why I'm in the field, right? But I really enjoy seeing the next thing coming down, and not just the next buzzword like when cloud came out. That's just in the cloud. When we have our own data center, it really doesn't save us. So it's just the next buzzword. AI is not. AI is definitely not a buzzword. And so we look at a lot of these specialized technologies or something that will take us to the next level. Today we do this, but tomorrow we could do this, right? And that's what we look to the vendors, our partners, to bring to us. We know what you guys are doing today. We know you. We know the apps that you have. We're that close. And so we can bridge this and take you to the next level. We know you're building 2 new hospitals, and we like to roll out the next level technology at these new hospitals. and we go back and we retrofit, right? That's what we did when we built out the Women's and Children's Hospital, right? We knew we wanted like to get these smartphones that are rolled out, and then what can we put on these smartphones? We went from, we didn't know, to now we have almost 20 applications that are on the smartphone that they can do, from the EMR to nurse call to other type of alerts and so forth. And so, you know, it takes us to that next level. And so we really look at that. And that's the specialized of purchasing, is that the vendors bring this to us. That's that niche, right, that they have. That, yeah, we're a vendor and we sell this other stuff, but here's the stuff that we sell that you don't have, and we're bringing it to you first, and we own this, and this is what we want. Or even if we don't own it, okay, we're a reseller of it, but you all don't do this today. You know, oh, that's really cool. Wow, let's talk more about that, and let's look into that, and so forth. And that's okay. We're buying this. We're buying this app. You know, this is what's going to bring to UH that we don't have today, like AI, right, in that specialized area, and then we start publicizing that, and some things is on the nurse side, and you know, it helps them be better, provide that patient care, right, if more effectively. But some things, like in AI, you see it can identify cancer that maybe a radiologist didn't identify. So we go out and we buy that app, right, that sits on top of our PAC system, right? So when they have those MRIs and so forth, oh my gosh, it notifies the radiologist, did you notice this on the scan? And then, oh my gosh, no, I did not. Let me look at that further. And so you're at the beginning stages of cancer. Oh my gosh, which is great news. It's good and bad, right? Double say, oh my gosh, you got cancer, but we caught it early, and that's huge for us. And so, you know, it's no different than going down to that nurse level, that they have these phones and they get these alerts, and they can go in there and provide that excellent patient care. And then it comes back when they do the survey, right? And we get these 5 out of 5 stars or what have you, right? They see great things about us because we're able to respond effectively. We know that, oh my gosh, this patient in room 103 just needs ice. And so instead of going to the room, I see you hit the nurse call button, and what can I help you with? Well, they already know. They need ice. They just come bring ice, right? They know that. They're effective. And so you deliver that better patient care. And so we're always looking at those type of things. So when we go out, we're buying this next level application or whatever, what can it bring to us that's different than what we have today? We'll throw this in the trash if we need to, because wow, look at this we can bring to the patients or to the clinical staff, you know, and that's really, I know it's a long answer, but but really, you know, that's what we look at, you know, and that's that model that the vendors can bring to University Health and other customers like that maybe we don't have or we don't know about, and so we buy that.
So a couple of things I took away. One is, because you're a governmental entity, you have procurement rules and processes that you have to go through. However, if there are kind of niche-ish things, there are ways to creatively work with partnering vendors to be compliant, but at the same time explore what something needs to be, so that it's not all about RFPs.
That's right.
And the other thing is, and I think the real key takeaway for this group, you value education. So you can only know about so much. So the people in this room have an opportunity with somebody like yourself to educate you about things that will, assuming they do their homework and they know what you need and what's going on in the organization, and that partnering vendor in their DNA, has that across their various disciplines, there's an opportunity to teach you things that you don't know, so that and that could end up in a sale.
100%. Yeah, exactly that. And that's, again, it all goes back to, why we're here today, when we're talking about this, is that partnership, is that, they know what we have today. So have you looked at this? Have you looked at that? And maybe they don't know everything, but that's fine. But oh, well, we have a similar, why is yours different? That kind of a thing. Well, this is what it can do. Let's just do a little show and tell. Simple meeting and to go over that. But yeah, you're 100% right. That allows us to buy this unique technology product because they own that. This vendor owns that, or this vendor brought it to you, and so they're first out of the gate, right? And so you're, wow, that's really unique, and that is different. And so it allows us to buy that product without having to go through a simple DIR, or let's get 3 quotes, because we're just gonna buy, another piece of hardware.
Yeah, so we can work on these things together, and we're in a position to bring you all kinds of things, as long as we don't break our trust with you, right? in the end, that's really what you're talking about. So show up, do your homework, listen to me, know what's going on across my organization, know what I'm about, and don't be afraid to bring me stuff that may be a little bit out of band, right? So, and you'll be willing to take risks with somebody if those risks can be shared too, right?
100%. And let's talk about that really quick on the risks, and then we can just, I guess, jump into questions or whatever. But and so when we're rolling out the smartphones, when we're talking about buying these smartphones, it was a risk. I'm taking the risk to the organization, but I think it's a risk that we need to take. It's something that I can see the future, that it's going to help the clinicians on the other side, because they're going to have all this knowledge and be able to really provide better patient care, right? And then you start having these conversations, and then you bring in, the Chris, and you realize, oh my gosh, I have no idea that we can do that. And it's not without road bumps. And so that's part of that education and training that the vendor can also provide. They're the experts. You guys are the experts. And so, hey, we're starting to see these complaints from our nursing staff and stuff. And well, let's look at that. Oh, it's just a lot of it is really just truly education and training, right? That kind of thing. And we did that with Women's and Children's. We had this giant powwow, and it was over several days, and it was great. And it helped us bridge that gap with our nursing, our clinical staff, as well as the providers. Providers showed up as well. How am I supposed to use this phone? Oh wow, that's really neat that this app can do these things, and so forth, right? And it really helps, and it reduces the complaints that we have out there. So it's huge. It's that entire piece, entire pie that really, seals that deal.
So before we go into questions, I want to ask a handful of more things. So we're here in 2025. All of us here are in the solutions business. Sometimes we call ourselves integrators, sometimes we call ourselves value-added resellers, but in the end, and Dr. Cole Edmondson was here yesterday and talked about solutioneering. We're all in the solutions business. What are things in the space that companies like we're playing in should be thinking ahead on, from your perspective?
Well, bringing that solution, the integration piece, it's there on some things, but there's clearly a gap. Especially with the technology today, you're seeing, a lot of technology, hitting the streets, and the integration piece is just okay. And I seen that, and I hate to keep going back to Chris. Sorry, dude. You guys recognize that. Clearly you have. because when he came to me today, he was like, hey, we're doing these things. And when he started telling me about it, and I had to tell him the story about this third party that I don't want to ever use again, when we're kind of rolling out these phones and building that environment. And I almost fired the individual, but he finally brought it in, and then we continued on, and because we're so deep into this project. But I'll tell you what, I ain't using that company again. And he clearly must have recognized that, or heard from the grapevine or something, because he came back to me and he's like, well, this is what we're doing, and we can fill that void that we know you have. Oh my gosh. And it just brought me back to, I think I was twitching because of I thought we were going to have such a bad outcome with this individual. And, he saw the need. He saw the need for this integration piece, right? And that's what you guys do, to bridge that gap that we have today, to fulfill a need that I'm going to have for the new hospital. And not just that, but something you need to have on the existing hospital that we're trying to roll out this technology as well, right? Saw the need, filled the void, and brought it to me, right? And I think that's important. That's what you guys think about that's going on, and some of your customers that you're dealing with. How can you bridge that gap and have that, fill the void, the need that your customers have. They may not know it, or they know it, but it's just kind of hanging out there, right? It's not on the top of their list yet, because maybe they're still building a new hospital or what have you, right? They're expanding and so forth. But yeah.
So let me ask you two last questions. In terms of partners in the various integration spaces and the types of technologies we play with, do you have a sense that there are competencies that you could use that we may not be giving you today? What are some competencies that you think are necessary to support an organization like yours?
Yeah. So, I would say definitely so, especially when it comes to, when we're taking on a new technology, and maybe you're taking on this technology, or your customer's taking on this new technology for this specific need or whatever, it's easy to just focus on that and that need, like myself for new hospitals. And you have to eventually, possibly, depends on what you're rolling out, go back and start retrofitting. And then that's the gap and that's the gotcha, right? Especially with the customers that you guys are dealing with. And so for these phones and the technology behind that, we were successful because of the partnership to roll it out on the new hospital, Women's and Children's. And shortly afterwards, we started retrofitting our adult-only hospital, right? And I thought, really, it would be an easy transition. It was quiet. It was quiet for about a year. And then I had no idea, because nursing, there's nursing leadership who attended when we had that training back then. And that's all forgotten. And now I got complaints.
So I think what you're saying is that a competency that two things come to mind. One is kind of solutions architecture that acknowledges and recognizes the fact that you have legacy things in your world. So even when you build new, you need to bridge the two. So that's an area. But I think the other thing that you're bringing to the surface here, and knowing a little bit about what's gone on over the last few years, you can't just show up with devices, drop them off on your dock and say, see ya. That there is change management from a technology standpoint, there's needs analysis and training, especially with an eye towards what the clinicians' needs are on the floors. And that's a place that it's sounding to me like that we can't do enough of.
Yeah. You got to continue that education, and I definitely missed that part, and it came back to kind of bite me, and so much that we're gonna have to have you guys come on site for a couple weeks or so, and to help the adult side of the hospital, right? And so that's a continued education, and so for as you're going back and retrofit, I think that helped me, right? That I think you can help your own partners, right? With that, we have this, continuing education, or that you want to go back and retrofit, the customers that I have. So yeah, it's definitely a challenge, and it's definitely something that you could definitely help your own customers.
Yeah, so you have a big organism, you need a lot of care and feeding, and the care and feeding piece sounds to me like it allowed you to kind of move forward, but also inherently, because of what you do, you got to be able to go forward and also back, right? Mm-hmm. So this, you mentioned the adult hospital and then the new buildings that you're building. So there's an opportunity for all of us to really pay attention to the fact that you don't just want to buy a technology from any of us. You want to have a relationship that you can rely upon to serve your customers' needs.
That's right, and that's the successful side, right? We want, bless you, we want to be successful on our side, and you guys want to be successful on your side. That way, you have that partnership with your clients, and then they say great things about you, right? As they move forward with that technology, not just the year that you rolled it out, but years down the road.
So let's open it up to the group a little bit, so all of us here on varying levels have had to deal with the Bill Mundts of the world, who can be blunt.
I'm sorry. You did. Apologize.
I'll ask a blunt question. Are you willing to pay for the relationship? Meaning that there's a lot of time and energy and salary and cost to us as integrators to be able to sit and do that consultative level solutioning with you. Would you find a good arrangement in which you're willing to pay for that relationship, which I know sounds horrible?
No, actually, you're actually correct, and that is usually the case. Usually it starts with a conversation, right? And then or where your customer could be saying that, hey, I have this problem, or you're bringing a new technology, and how's it going to look like in the environment, architectural and so forth, as you're laying that out. And it starts with that, and yeah, it is that cost that is associated with that. But the fact that we have this relationship, and that wow, yeah, it sounds interesting, and let's show me, let me invite my tech staff, right, and we can look at that and see if that's something we want to move forward with, and then it gets into the more of the details that, okay, now we bought it. Not necessarily we bought the product yet, but now we're getting into the architecture of it and how that's going to fit in our environment and what changes that we have to make in our environment to make that happen. And then yeah, let's do it, right?
So are you willing to pay?
Yeah, and we have, and we do today. Right, and that is part of that partnership. So it's definitely that you got to pay. Nothing's free.
So when you go through the vendor selection process, certain aspects of it you're going to have to buy on price, no matter what. But in terms of a criteria, you're willing to pay for better service.
Yes, and just because it's cheaper, that doesn't mean that vendor's great. Right, and we've excluded vendors because of that we've had bad installs and bad relationships with that vendor, and so we're no longer going to work with that vendor. So we're not going to have those conversations. Whether it's an RFP and they bid on that, or maybe they're trying to bring in something to you. But reality is that if you already have that bad taste with that vendor, you lost the trust, right? And so, that's not going to happen. That wouldn't continue on anyway. But those that you do, it's expected.
All right, good. Any other questions? Dan?
You talked a lot about the relationship at the sales level or at the introduction level, but the holistic, you kind of hit on the idea of the holistic experience. A good part of the room is the operations side of the business. And how important is it to you to have the holistic experience from your partner?
Yeah, it's actually very important. So in my example that I talked about, when we bought these phones and we were loading these apps, and then we had to build this profile, the sales individual said, we have this third-party company, they're great, this guy is fantastic, and he's going to help you roll it out and build these profiles of these phones and all that stuff. Great. So, all right. So we got in the contract. We to do such as that, and then I put them in touch with our tech guys, and they worked together. From a technology standpoint, it was fine. But when that engineer, let's say, was talking to our chief nursing executive team and was saying things, bad things about the environment and scaring them, that's when I almost fired, right? And that was enough, how your environment is, and you guys are flat and all that stuff. You don't know. And so I could have one-on-one conversation with this guy, and I told him why we're laid out that way and so forth. These are the reasons why. He would take that and he would go and talk to the chief nursing staff, right? All the VPs on the clinical side, scare the heck out of them, and enough is enough. And so that's the holistic of that. It is more than just a sales individual. It is those that also are going to do the installs. That you get the A team. This is the first time we're trying to get this app in our environment. We shouldn't have issues because maybe you assign someone new to the team, or everybody's new to the team. And so, just one quick example: when we rolled out ServiceNow, we did the core implementation of ServiceNow, our help desk ticketing system, and that company's never coming back. We got the B team. Clearly, we got the junior varsity team, and it was a struggle. The install was supposed to take 4 months. It took us 8, and we bought, again, just the core of ServiceNow, but we're buying more. Why couldn't they see that down the road, that we're going to buy these other modules? We did. January, we bought 2 other modules. Someone else is helping us do the install. They're no longer invited back, right? Salesperson I know, great person, they subbed it out. They brought in this other company, and it was a nightmare. When our own staff know more than the installers, that's a problem. And that's what we had there. And so, and that's how you lose business, future business.
Yeah, we all have to sing from the same hymnal, and whoever it is that is touching you at whatever level has got to be saying the same kinds of things and being consistent.
Yeah.
Any more questions? Donna.
Uh-oh.
Thanks, Bill. This was great insight. We really appreciate you being so transparent with us. I think it really is helpful. I was thinking about, I'd like to hear from you when we looked at your map and you're planning your strategy and you're looking at the future. What type of issues or problems are you thinking about? One of the initiatives you said is we're moving into the home. We're taking patients home. Can you talk about some of the things that you're maybe worried about or you think are potential problems that you're going to need partners to potentially help you with?
I got to go back to cybersecurity. So cybersecurity is huge. There's a lot of vendors out there that have a lot of products, whether it's a physical device technology or software. Some are hosted, some are on-prem, and there's all sorts of things. So what scares me today is because of everybody that gets hacked is cyber first. And so we've seen some wonderful flowery things, but push come to shove, we're not willing to accept the risk to bring in this technology in our environment because of the cyber risk. And so that's first and foremost. After that becomes really the use of it. So there's always a balance with cybersecurity, that there's some risk you're willing to accept because of what it provides to the patient or the clinicians on that side. And so you got to look at the big piece. While my CISO, my cyber lead, right, says no to everything, right? And that's what I want him to do. So, and he's come to me multiple times and said, "You want me to ease up? No, that's not your job. Your job is to be mean and get on the vendors and push them. And then when it's all said and done, what are the risks? And then bring that to me." And we have a formal process, very formal process, because it gets audited. And so, but you have to look at the big picture, and that's what I'm here for, to look at that big picture, you know, hear from the clinician side, the OR nurse, the VP saying we really need this, and then I hear from the technology side or the cyber risk side, and these are some of the risks, or these are some of the things that we're going to have to do to make this happen, and I got to balance that out. And some things we're willing to accept, some things we're not. And so, you know, at the end of the day, it is a balance. You know, home care today is huge, and we're getting funding for it. And then the government got on board because of COVID. And so we get paid for that now, which is great. And so we really ramped up home care. And so we have devices that these patients take home with them. Some of them they keep, some of them they're ours. And so I got to look at that technology. Well, where's the data going? Is it PHI? Is it PII? You know, how are we receiving that data back? And so it is that whole balance, as well as expanding, you know, that new niche that we have, which is home care patients. You know, they're leaving from being an inpatient and they're going home, and we're monitoring their heart, dialysis, all these things that's going on in, you know, for home care. And as technology comes out, we look and we help evaluate that. And some things we're willing to accept, some things we're not. There's one that we're doing today that we're going to give the patient an iPad. And so it's a lower level iPads and so forth. And I had to look at all of that to make that happen. And you know, that's my job. And while the data security guy is saying, there's no way we can't do that. Well, there is a way. We just look at the technology a different way, and how do we ensure what data is really crossing? Is it really PHI, or is it just, you know, these individuals, you know, stats, you know, the heart rate, you know, whatever. And so that's the balance of that, you know, and you know, that's how we ensure that we meet both sides of the house, whether someone brings you the technology from external, via the vendor or whatever, or a clinician brings that to you because they went to some conference. And, you know, and you look at that. And if the risk is too much, we're gonna have to look for another vendor. I'm sorry, but we're gonna go elsewhere and see, because I'm sure they can't be the only ones that can do that type of technology. Yeah.
Thank you.
You're welcome.
Do we have any more questions? Great. Thank you, Bill. You've been great.
Appreciate it. Thank you.
Thanks so much for joining us today on CarePoints. I encourage you to hit the like button and subscribe so that you can get notified when we release our next episodes. Make sure to subscribe on your favorite podcasting service, Apple, Spotify, iHeartRadio, whatever your favorite platform is. And make sure to visit us on the web at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. You'll find all of our old episodes there. Thanks so much for listening, and looking forward to having you back soon.